Welcome to our webinar today. This is Emily Rhines, Director of the Maine Cancer Consortium. This is our third webinar in a series this year around addressing policy and environmental change. Today's webinar is brought to you by Sarah Mayberry from the Breathe Easy Coalition and Lance Bushy from the Lung Association of Northern New England. They're going to be talking about addressing emerging tobacco products through policy change. Thank you very much to Lance and for Sarah for your willingness to do this webinar for us today. I'm just going to tell you a couple things about the consortium as we kick this off. Hopefully you know about the consortium since you're on our webinar today, and hopefully you've been on a couple of our past webinars. Like I said, this is the third of this series. Our mission is to promote and preserve the health and quality of life of the people and communities of Maine by minimizing the impact of cancer. We are funded by the Maine Centers for Disease Control's Comp Cancer program, so thank you to them for our funding and the support to make this possible. Our webinar will be recorded and posted on our website, mainecancerconsortium.org. You can also sign up for our listserv or send me an email that's going to be on the final slide, and we will get you signed up for that listserv. A couple logisticals for the webinar. Everybody is going to be muted throughout the presentation. We will have a Q&A session at the end of the webinar and would love to have some interactive conversation. You can type a question at any time in the question box on the right-hand side of your screen, and we will capture those and get them at the end, or like I said, we'll have an interactive real conversation then as well. So I'm going to pass this off to Lance, and he's going to get us started.
Hi there. Sarah, did you say I was doing the slides or you're going to? I'm sorry.
We'll do them for you, Lance, if that maybe just to make it easier. If you just let me know, we'll hit them.
Sure. Well, the first thing right there is just a couple of the topics that we're going to cover over the next 10 minutes or so. I'm going to do a brief overview of what other tobacco products are, show some examples of other tobacco products through pictures, talk a little bit about how they are marketed by the industry and the usage rates among youth particularly, and then just talk a little bit about the cost of these products and how they are taxed. So we will go to the next slide. As most of you probably know, tobacco is responsible for approximately 1 in 5 deaths, according to the CDC, with more than 480,000 people annually dying. The tobacco industry knows that it has to groom and hook the next generation of users for their products. And with about 90% of smokers reporting that they started using tobacco before the age of 18, the industry kind of knows that their survival is dependent upon youth use of their products. Retailers are also aware of the opportunity to a very lucrative industry and make money in sales, and there's huge growth potential in the other tobacco product sector. Smokeless sales have been rising steadily for the past 5 years, and according to the Federal Trade Commission, marketing for these products from 1998 to 2011 increased by 210%, and it's now about $500 million of marketing annually for these products. And Convenience Store Association of America is well aware of that, and they often hold webinars and trainings and have published guidance on the Trade Association website on how to increase sales of these products and to best market them. So next slide. Most of these products sort of are designed to have easy entry into nicotine addiction. They're often flavored, less harsh than your traditional Camel cigarette. And like we'll talk about a little bit in the next couple of slides over e-cigarettes, tobacco companies are using practices from their past when they develop OTP products and market them. Documents from the tobacco settlement showed that the industry developed starter products to entice kids before graduating them to stronger tobacco products. So you can see some of these OTP products with their packaging or flavoring are following in that vein. Next slide. Much of the industry's characterization of these products is in a tobacco harm model. The report on the right on this slide is from a professor who's received funding from the tobacco industry and runs a blog project in support of harm reduction theories by using smokeless products. And we saw it not too long ago in the legislature when the industry lobbyist for R.J. Reynolds sort of presented their continuum of harm reduction with cigarettes on the furthest right-hand side of most harm down to some of their smokeless products with less harm. American Lung Association, the public health community, does not buy into sort of the harmless argument. Some side effect or some diseases related to these products include oral cancer, gum disease, heart disease, nicotine addiction, increased risk of different types of cancers. So not exactly harmless. Next page. So now a couple of slides here just showing some of these products and how they are marketed and packaged right now. The first one is moist snuff or chewing tobacco, and as you can see, it comes in a variety of flavors from peach and spearmint. And they've also started with the little snooze packages, these really clever little tiny concealable metallic canisters. And this is just sort of your traditional Skoal type products. Next slide. Another product that is more in test development and not as readily seen is dissolvable tobacco. A couple of the examples and then photographed next to products that they kind of look like are both the Tic Tac type orbs, and then they have the breath marketing breath strips, much like the Listerine strips. And this is finely processed tobacco that is processed in a way that it allows it to dissolve in the mouth when the user has it, just like a Tic Tac or a breath strip would be. And again, these are sort of look like products that parents might think their teens are using a Tic Tac or a breath strip, not a tobacco or nicotine product. Next slide. Little cigars are one that is, much like e-cigarettes, seems to be emerging quite a bit in use data and a concern. And the American, the Campaign for Tobacco-Free Kids sort of coined these as not your grandfather's cigar. And if you look at how they are packaged, and they're not like the traditional Swisher Sweets of the past, they now come in a variety of flavors, and we'll see some of that on the next page. So a little cigar is much like these individual cigars. It's the same size as a cigarette, however, it still retains the legal classification as a cigar because it's wrapped in a tobacco leaf or a mix of tobacco leaf and paper. So on the picture to the left here, on the left-hand side is a traditional combustible cigarette, and the little brown cigarette look thing is a little cigar. Maine has a ban on little cigar flavorings. However, it's limited as products are grandfathered on the market if they were available before July 2009, and there's been no change in characterizing flavor or changes to the packaging and labeling. That law is being openly violated. If you go into any tobacco shop today, you will find a host of flavors that are not on the grandfathered list in Maine, from peach martini and body shot or trance. So a variety of flavors. We have been working with the tobacco enforcement coordinator at the Attorney General's office to develop a way that we could tighten up what is being sold and the flavors that are available. And one of the, to demonstrate just a little further the shady nature of some of these companies, some companies have taken to adding kitty litter clay into their little cigars to increase their weight, and that allows them to be taxed at a lower federal tax rate. Bloomberg News estimates that last year this tactic resulted in 12 companies avoiding paying $1.1 billion less in taxes. So next slide. In addition to the flavors, another concern with these products in youth attractiveness is their price point. These are substantially cheaper than cigarettes, and this is a shopping trip that I did in December of 2014. The photo on the left is my best guess at what a teenager might buy at a convenience store of Doritos, an energy drink, and Sour Patch Kids. Those three things were more expensive than the pack of little cigars that I purchased. The middle document is the receipt, and the far right picture is a sign on the gas pump at the Big Apple on Western Avenue promoting these products as a very low-cost tobacco product. Next slide. Okay, didn't realize that was animated. Next product that we're going to talk about a little bit is electronic cigarettes. I may, during the course of these slides, refer to them either as vaping devices or electronic nicotine delivery systems. The vocabulary around them is changing, or how we talk about them is changing slightly. So the e-cigarette closable system come in all shapes, sizes, and colors, but most have the same standard composition with a either rechargeable or disposable battery, a vaporizing chamber and atomizer, and a cartridge that is filled with liquid nicotine. When a user inhales, it's detected, the airflow is detected, and a microprocessor starts the process to heat liquid and vaporize it. The cartridge contains, among other things, propylene glycol, liquid nicotine, and flavoring. And the combustion of the liquid produces a vapor-like mist that looks like smoke and delivers the nicotine into the user. Next slide. These products, some of the public health community has started to refer to as the Wild West of tobacco, as they are currently unregulated. About 400 or odd days ago, the U.S. Food and Drug Administration had proposed a demon regulation to bring these under their jurisdiction. However, that is still sitting in the White House awaiting final sign-off from the President before the demon regulation is moved forward. They are explosive growth in market. Last year, sales exceeded $2.5 billion. Of that $2.5 billion, the real explosive growth is starting in the open container systems, where not sort of the disposables that are sold at gas stations, but the refillable products that users can put their own liquid nicotine into. Big Tobacco has realized the potential here, and all three of the major tobacco companies now have an electronic cigarette product that they are marketing. And industry analysts and financial gurus estimate that within 10 years, e-cigarette sales will pass traditional tobacco sales. Next slide. In Maine, electronic cigarettes are allowed to be sold and are considered a tobacco product under Maine's retail statutes. One of the things Sarah, I believe, is going to be talking about later is they're not part of Maine's smoke-free statutes. Thus, they can be used in a variety of environments where traditional tobacco smoking is prohibited. That could change. Actually, right before this webinar started, I was listening to the Maine State Senate was debating LD 1108, which would include electronic cigarettes in Maine's smoke-free laws. That legislation passed the House on Monday by a 90 to 56 vote, and it did just pass, had its first vote in the Senate and passed unanimously. So it's still got a significant amount of the legislative process to go through, but it has received favorable votes in both chambers so far of the Maine legislature. Next slide. As I mentioned, the use of cigarettes, e-cigarettes, is growing exponentially. Since 2000, it's tripled over the last year among high school students. Now, nationally, 13.4% have reported using e-cigarettes. And in a study that came out a survey that came out not too long ago, use of e-cigarettes has eclipsed that of traditional combustible cigarettes among youth for the first time. We don't have Maine-specific data yet. We will. That is going to be on the next version of the MIAS survey. So right now we have just the national numbers. Next slide. So just going to talk a couple of concerns that the public health community has with electronic cigarettes and vaping devices. Vapor aerosol is not harmless. That you often hear some advocates or proponents of these devices say that it is a simple water mist or water vapor. However, initial studies have demonstrated the presence of many chemicals, metals, including carcinogens, in the aerosol emitted from e-cigarettes and vaping devices. And there is a short list of some of those that have been found in studies. Next slide. Another concern is the dual use. Both the industry markets this as a you don't need to quit using an electronic cigarette in places where you can't use your traditional combustible cigarette. And a survey a couple of years ago showed that almost 77% of people who regularly use these cigarettes also smoked conventional cigarettes. So that is a growing concern. Next slide. And one of the other areas of growing concern, given the lack of prohibition of e-cigarettes being used in workplaces and whatnot, is the renormalization and the glamorization of smoke. And this is an ad for a Canadian brand e-cigarette, Regal. But over the last 50 years, the public health community has made great strides in shifting the cultural views toward tobacco use, and this progress stands to be eroded as the use of electronic nicotine delivery systems steadily grows and the exposure of these devices in young and one of the final concerns, this one relates more to the open systems where people refill their devices with liquid nicotine, is the accessible and attractive poison. You probably have seen some of the news reports about the vast spike in calls to poison control centers. Last year, there were over 3,800 calls nationally, which was nearly 150% increase to poison control centers about accidental exposure to liquid nicotine. In Maine, there have been calls to the poison control center that's for northern New England in Maine, but it hasn't been at the same volume as the country. But you can see this chart on the right shows the number of calls and how many of those are connected to youth. This is concerning because ingestion of liquid nicotine can be toxic in relatively low doses. A teaspoon of 1.8% liquid nicotine could be fatal to a 198-pound person. Thus, the fatal dose for a child is relatively small. And nationwide, there has been one death attributed to liquid nicotine ingestion, and that was a 1-year-old who died in December of last year in upstate New York. That could change in Maine. A piece of legislation, LD 423, passed unanimously in both chambers, which would require those little vials that are pictured on the left to be sold in child-proof containers, as demonstrated by the Consumer Products Trade Commission. So they would have to have caps similar to a medicine bottle cap, which would ideally cut down on accidental youth ingestion. Next slide. So this chart shows some of the usage data in Maine for other tobacco products, not including e-cigarettes. And as you can see, there's a very high rate of use, particularly in cigars and little cigars, with high school males having a nearly 16% usage rate. And then the green bar chart shows chewing tobacco. And next slide. I'm going to show just a couple of ways that both electronic cigarettes and other tobacco products are marketed, particularly towards youth. The past couple of years, tobacco marketing seems to be returning quite substantially. It curtailed some after the master settlement agreement in the early 2000s, but now in Maine alone in 2011, tobacco marketing by the industry was almost $41 million, with the state spending about $8 million a year in tobacco prevention efforts. That means that for every dollar the state spends, the industry is spending $5 in marketing to addict tobacco consumers. Next slide. These are some ads from the past couple of years for Camel's snus products, and it just shows how they, what we talked about earlier about dual use, how they are sort of marketing these for use these where you can't smoke because of tobacco bans or smoking bans. Next slide. Here are some examples of electronic cigarette marketing. They have also all forms of advertising. Electronic cigarettes have taken over from television, radio, print, billboards, and online social media advertising. Last year, blue cigarettes alone spent over $40 million in U.S. marketing, and the spending on e-cigarette TV ads has increased almost 20%, and print ad spending has increased over 70%. The ad on the right of a bikini bottom was in this year, or the 2015 Sports Illustrated Swimsuit edition, and that is a magazine that has a very high, that issue has a high viewership or readership among high school and young adult males. So clearly a planned targeted ad. Next slide. And here's some of the local marketing, non-traditional marketing that we saw. I guess this was probably about a year ago in Maine. Those two vehicles are for a Southern Maine e-cigarette company, Smoke Ends, and they were, the photos were sent to us by a public health professional from Southern Maine who had seen these cars parked at Thornton Academy on several occasions. After some inquiries with the department, the American Lung Association, and the Attorney General's office, Thornton Academy, with some outreach to the company, those cars are no longer being driven to the school. Next slide. Actually, if you could skip this one, then to pull up this one here. The tax differential, as we talked about, actually skip right to the last one, I'm sorry. So OTP is taxed at a much lower rate than cigarettes in Maine, and we are also significantly lower than the rest of New England on taxation of OTP. You can see we tax at 20% of the wholesale price, which on that pack of $1.09 little cigars I bought, there's less than 15 cents of tax in that price. Some public health advocates have called for an equalization of other tobacco products to the current rate of cigarettes, which would generate about $8 million a year in revenue. And as you can see, like I think I mentioned, we are currently the lowest in New England at our tax rate for OTP products. And there has been discussion of equalization in the legislative session. However, that is not going to materialize this year. And next slide, and I think that's all of them. So that is sort of a summary of other tobacco products, what they are, and means that.
Wonderful. Thank you so much, Lance. Really appreciate your overview of some of those emerging tobacco products and OTP, as well as the advertising that we're up against and why some of these public health changes are so necessary. Good afternoon, everyone. Just to continue on with our presentation, my name is Sarah Mayberry. I'm here with the Breathe Easy Coalition of Maine. I'm happy to be able to partner on this webinar today. We work in the areas of creating smoke-free environments through reduction in exposure to secondhand smoke, specifically in the areas of multi-unit housing, healthcare systems or hospitals, behavioral health facilities, as well as colleges and university campuses. And the work that I'm going to talk about going forward is made possible through funding and support from the Maine CDC and the Partnership for Tobacco-Free Maine. So now that we've sort of gone over some of the broad scope of the new and emerging products, also wanted to take some time to talk about getting back to basics, why we want to address tobacco, and especially through policy change, which I'm going to be chatting about. Tobacco use continues to be the leading cause of preventable disease and death. As well as when we talk about policy, we're talking about secondhand smoke, so that smoke that comes off the burning end of a cigarette or is exhaled by a smoker. And we know that even brief exposure can cause damage that can lead to serious disease and death as well. And this is highlighted in a series of Surgeon General's reports coming out most recently in 2014 with our 50th anniversary edition. But first, as we've highlighted here, a couple both about secondhand smoke aspects that came out in 2006 and 2010 that I'm going to be citing later in the presentation. But also a really important reason to address tobacco through policy is the fact that creating these tobacco-free areas will change the social norm around use and promotes the tobacco-free lifestyles. Coming out of the 2014 Surgeon General's report, we saw an increase here on the slide on the right-hand side here, our document showing the dangers related to tobacco use. As you'll see in the red were newly added chronic diseases and cancers that are associated with tobacco. So cigarette smoking, we know, accounts for at least 30% of cancer deaths. The products, some of which that Lance was speaking on earlier, the smokeless tobacco products, so our chew and snuff, also have cancer risks. So looking at oral, esophageal, and pancreatic cancer. And when we say that there's no risk-free level of exposure to secondhand smoke, that also stands true to cancer risk, knowing that living with a person who smokes, a non-smoker, increases their chances of developing lung cancer by 20 to 30%. So these are things why it's important to both have smoke-free policies to take it out of your home, move it away from non-users and youth, and also to consider quitting. The next thing is we know that tobacco-free policies work. They're an evidence-based strategy for addressing a number of public health aspects of tobacco. This is pulled from the Community Guide, which is a sort of national standard we have for public health on best practices. And they've done the research and found that tobacco-free policies will reduce exposure to secondhand smoke, reduce the prevalence of tobacco use, increase the number of tobacco users who quit, reduce initiation by young people, and reduce tobacco-related morbidity and mortality, including acute cardiovascular events. This really makes a great case for, I think, why we want tobacco-free environments, that they can go a long way in addressing the comprehensive approach to tobacco, both creating that social norm and stopping young people from starting, where we know that 99% of tobacco users start before the age of 26. They can support the numerous tobacco users who are thinking about or moving along the stages of change for wanting to quit, and can reduce non-smoker exposure to secondhand smoke. So as Lance alluded to, we have a great set of laws in Maine that protect people from secondhand smoke and support these smoke-free lifestyles. But there are some limitations to these great policies, such as not currently including electronic cigarettes and some of the other emerging products. So just a quick overview of some of Maine's laws that have really sort of been in place and made a great area for secondhand smoke protection. We have strong workplace laws that require indoor areas to be smoke-free, and also vehicles owned by your business or used in the course of work. Indoor public places are smoke-free, Restaurants and bars, including outdoor dining areas, so patio areas and things, are smoke-free. Since 2009, our state parks, beaches, and historical sites have been smoke-free, as well as vehicles when children under the age of 16 are present are also required to not allow smoking. So we have a great set of comprehensive laws, but we have the opportunity through voluntary policy change to go further. So these can build on our laws and also protect against some of the products that Lance was talking about. So these emerging tobacco products or other tobacco products need to be included if we're trying to make that real social norm change and protect people from the vapor and aerosol as well. So as I mentioned, that the main laws are smoke-free laws, and we really want to look at best practice tobacco-free policies that can address all of these products, so addressing the emerging issues as well as electronic cigarettes. And a report out of the CDC about youth and young adult use stated that the increase in use of these alternative products could be due to the increased marketing and availability that Lance cited earlier, and the visibility of these products, but also the perception that they're safer alternatives. So if we have a policy that's allowing someone to not smoke traditional tobacco products or smoke cigarettes, but they're allowed to use e-cigarettes, it automatically is creating that perception that those products might be safer, and also that the aerosol is safe comparative to the secondhand smoke. So we want to look at best practice voluntary tobacco policies. So an organization that you might be working with, whether it's a community group, a work site, the organization that you're representing, to be looking at going 100% tobacco-free, that we want to be talking about tobacco-free campus policies. So it's an area where you're making sure that you're addressing all products. Up here we have a sort of definition where we talk about addressing all tobacco products, not limited to cigarettes, cigars, pipes, chew, snuff, snus, electronic nicotine delivery systems. And so as you see, I know over the years that we've been working on this, our list keeps extending and growing. So, but trying to have that comprehensive definition to say we really are a tobacco-free campus, and we want to support people who are trying to quit using tobacco. And making sure that it covers all of your property. So coming onto the grounds that it's an area where tobacco is not allowed, and I'm going to talk about some examples of where that's worked. Also, other parts about making sure that you're having a best practice policy is that you're supporting people who are trying to quit. So if you're a healthcare organization, that you're integrating tobacco treatment and screening into practice. We're lucky in Maine to have a really wonderful free resource through the Maine Tobacco Helpline that you can be referring folks out to that will provide phone counseling and support. So making sure that you're talking to people on intake if you're a provider about their tobacco use, and as well as their exposure to secondhand smoke. And also making sure if you're an employer or a community group that you're offering tobacco treatment benefits and letting people know about what resources are available to them. So now that I've gone over my really quick overview of sort of why tobacco policies are a good way to address tobacco, I like to pretend that it's a quick, easy process that we can do in 7 steps to adopt a policy. But I know anyone who's out there who's adopted one knows that this is a serious thing to undertake and take some time. But there are some key components that you want to make sure you're looking at. So if you're working with an organization or your organization you're at is looking at going tobacco-free, you want to start out by finding a group of stakeholders that you can pull together to create either a policy committee or work group. So this could be your existing tobacco wellness council or organization. So once you've done that, develop a timeline for change. When will it work for you to be tobacco-free? Is there an opportunity to kick something off with a big organizational event or to align it with one of the national days? We've seen a lot of organizations that have successfully gone tobacco-free with aligning it with the Great American Smokeout or World No Tobacco Day or the start of a new season. But making sure you also put enough time in for a lot of education about all of the components that we've outlined today in the webinar thus far, that you're talking about why your reasoning is for doing this. Then you want to think about drafting your tobacco-free policy, and that's where groups like the Breathe Easy Coalition or your local Health Humane Partnership can be a great ally in making sure that you have some of that best practice language. And you can then, once you have sort of that structure, what you want to do, your timeline for change, you have a policy plan that you're, where it's going to cover, what products it's going to cover, that you want to start building your support from key stakeholders. So talking to your upper management, people who need to be on board with the policy to move forward. Talking to your tobacco users, explaining to them that this really is about the smoke, not the smoker. That you're asking someone that this is a benefit to the wellness of the organization, but you're not asking them to quit, but it might be a time when they're ready to do it on their own. Positively communicate the policy. As I mentioned, a lot of the things here we're talking about the health effects and different components that are going on, but this really is a great opportunity to support wellness for your organization. So talk about how you're going to be protecting people from secondhand smoke. Speak positively about the benefits of quitting, and about your plan as how you're going to go tobacco-free and what an exciting thing this is to do. Along those lines, you also want to be preparing and distributing educational materials about your policy, tobacco, quit resources, secondhand smoke dangers, so that people can understand why you're doing this and can follow proper plans and hopefully be in support as you implement this. So then you'll want to move forward and implement and enforce your policy. So we've sort of broken this down here into one quick slide that really is about a 6 or a 12-month process, depending on where your organization is currently at. But these are things that there are also resources to help you with. As I mentioned, we have a great network of local public health workers in our local Health Humane Partnership. So connecting with one in your community who can help support smoke-free and tobacco-free policy efforts, and can also connect you with someone who's probably a similar organization who has done this. Also, if you want, the Breathe Easy Coalition and the Partnership for Tobacco-Free Maine are additional great resources. So now that we've gone over briefly some of the keys of how and why you can adopt a policy, one of the things we wanted to highlight are some of the great examples of what's happening in Maine. We have a lot of great laws, as we mentioned, a good comprehensive set of those, but we've also got a lot of organizations that have been policy leaders in adopting tobacco-free policies. So I wanted to highlight some of those in the areas that we work at with the Breathe Easy Coalition that we know are also connected here with the Maine Cancer Consortium. One of the great areas to start talking about tobacco-free environments with is healthcare facilities and healthcare organizations. So trying to breathe easy when you're at a Maine hospital is vital when you're looking at this and you're talking about how we can both model healthy behaviors for individuals, but also to encourage those tobacco-free policy changes in your community. I think it's a great thing to be able to look at the local hospital and say, hey, they've got this comprehensive tobacco-free policy, and we want to support others to do the same. And nationally and locally, we're starting to see some great support for these tobacco-free hospitals. In a couple of years ago, we had a position statement put out by the Maine Hospital Association supporting these comprehensive tobacco-free policies. So it's really in a hope that they're seeing that this is part of the healthcare organization's mission, is to create that healthier community. And this does benefit everyone, especially if you're going into the hospital, unfortunately, dealing with treatment or different components. That exposure to secondhand smoke and that support for being tobacco-free yourself is huge as part of your recovery and wellness. And in Maine, we're seeing that a great number of hospitals are going tobacco-free, which is really exciting. On this map here that was developed by the Maine CDC, hopefully folks can see that just really that the yellow dots are continuously extending. Going from 2006 to 2014, we've seen a huge increase across the state in the number of hospitals that do have 100% tobacco-free policies. So they're following that definition that I showed earlier, where they're addressing all tobacco products on all of their grounds, including in parking lots and vehicles. And so we've seen about 80% of Maine hospitals who have adopted these strong policies so far. An additional sort of gauge of how hospitals are doing through the Breathe Easy Coalition and our Maine Tobacco-Free Hospital Network, we have a Gold Star Standards of Excellence program, which gives hospitals an opportunity to be recognized for meeting at least 6 of 10 best practice standards for addressing tobacco. And they're things that are not that easy. Everything from these comprehensive tobacco policies to having a policy that addresses third-hand smoke, which is that lingering tobacco smoke, that residue that stays on clothing and can be harmful to non-smokers and especially to children, to divesting from tobacco industry stock and making sure that they have best practice procedures in place for tobacco treatment and screening. And we've seen 31 Maine hospitals recognized in the 2014 program that they met at least 6 of these 10 best practice standards. So we're seeing a lot of hospitals that have gone a long way to be those role models and leaders in addressing tobacco. Our next component that we want to look at is colleges and universities. As I mentioned earlier, a 2012 report from the U.S. Surgeon General states that nearly 99% of tobacco users begin before the age of 26. So it's a great opportunity really to get people to make sure they maintain that tobacco-free lifestyle from day one and not become addicted to nicotine, because what we're really talking about when we talk about these health effects is are consequences of a really unfortunate addiction and a really strong addiction. So if we can create environments that are supportive of being tobacco-free from day one, so for kids who go through a K through 12 school that's tobacco-free, if they can maintain it at a college campus that is also doing that, they'll be much less likely to begin using tobacco based upon those evidence-based strategies we know about tobacco use. So again, working with colleges to make sure that they understand their role in this and providing a safe and healthy environment to live and learn for students, as well as being large employers, that they're supporting their faculty and staff and visitors to their campus on having that safe, tobacco-free social norm. So again, we've seen a lot of growing support for tobacco-free colleges, including the American College Health Association putting out a position statement now multiple times highlighting a comprehensive approach to addressing tobacco for college campuses. It was most recently updated to include the fact that their tobacco-free campus policies should include electronic cigarettes, because we know as that marketing that Lance was showing, really the target audiences are our youth and young adults. And so we don't want this to be another avenue to that nicotine addiction. We're at a really exciting time with Maine colleges and universities in adopting tobacco-free policies and really being a leader as we're seeing this happen. Nationally, we went from probably 3 years ago just 300 or 400 colleges being tobacco-free to now there being over 1,000. And in Maine, we have now seen over half of our colleges and universities adopt 100% tobacco-free campus policies. And we know that there's a variety that are looking at adding those policies now. So it's a really exciting time to see them stepping up and taking this on. I should have thrown in the progression map also that we had similarly for hospitals, because we know that pre-2011 we had just one school in Maine that was tobacco-free. And now we're sitting with over 15 schools in Maine that have tobacco-free policies. So that's a huge change in just under 5 years. Similarly to hospitals, we also have a gauge for this comprehensive approach in addressing tobacco for schools with the Gold Star Standards of Excellence program. And we had 12 schools in Maine that were highlighted in our 2015 program, actually, sorry about that, highlighting 7 schools that met all 10 of our best practice standards for everything from making sure that some of that advertising that Lance was showing is not allowed on their campus or in campus publications, making sure that they are having a tobacco-free environment, they're supporting students and staff who want to quit, and that when visitors are coming to their campus, they're highlighting the lodging options in their community that are smoke-free. So really having that social norming change going into effect, and we're starting to see a lot of schools who are doing that, so it's a really exciting time. As we started to talk about this at the beginning, and the dangers, unfortunately, about secondhand smoke exposure, I highlighted the fact about how a non-smoker who lives with a smoker has an increased risk of lung cancer by 20 to 30%. So making sure that smoking is taken out of your home is a huge opportunity to really reduce the risk for secondhand smoke exposure when we talk about non-smokers as well as youth. We know that there's no risk-free level of exposure to secondhand smoke, and when we also talk about multi-unit housing, so apartment buildings, condos, duplexes, and anything along that line, that secondhand smoke also doesn't stay within your individual unit. Between 10 to 65% of air is exchanged between units in a multi-unit building. And unfortunately, those pesky toxins in secondhand smoke move with that air. So making sure that we have smoke-free environments is a really strong way to protect people from secondhand smoke. So just a couple of gauges about some exciting things of where we're at in Maine. With this, we've seen 100% of our public housing authorities go smoke-free. We're actually the first state in the nation to have all of our housing authorities be smoke-free that way. A 2014 evaluation we did with Critical Insights found that 65% of landlords have at least one building that's 100% smoke-free across the state. So it's really exciting. We're starting to see people protected from secondhand smoke. But this supply still doesn't meet the demand of residents who, both smokers and non-smokers, say they would prefer to live in a smoke-free environment. So it's about 8 out of 10 tenants now that would prefer to have that secondhand smoke outside of their building. And we know from studies that have been done from different data sources that many smokers are now choosing to smoke outside because they understand how harmful it can be to others. Our pretty GIS map here in the corner shows another opportunity for public health professionals to get involved with the Smoke-Free Homes Pledge. It's an opportunity to invite individual families, whether it's single-family home or multi-unit family home, to pledge not to allow smoking by themselves or by others in their home. So they're pledging to keep their home smoke-free by taking it outside, asking people not to smoke, or by quitting. We've seen nearly 5,000 people take the pledge since its inception about 7 years ago. And so it's an opportunity when you're talking with folks, whether they're clients or out in the community, to have them say, you know, take a little moment to pledge to keep their home smoke-free, and they can be added to this map. It's a free online resource. And so thanks to the Maine CDC for that. That shows sort of where we're starting to see a lot of people taking this across the state. And when folks take that pledge, they also get information about quit resources like the Maine Tobacco Helpline and how to connect to other wellness opportunities through their local Healthy Maine Partnership and others. As we wrap up our presentation and get ready to move into questions, wanted to just put in one more opportunity for some of those key talking points about tobacco-free policy change. The fact that tobacco use remains the leading cause of preventable disease and death, and changing policies encourages individual quit attempts as well as changes the social norm around tobacco use. We also know that secondhand smoke travels and is harmful to others in both indoor and outdoor environments. So the only way to really reduce that exposure to secondhand smoke is to prohibit smoking in those places. And if you want to be successful in going tobacco-free and also supporting people in living tobacco-free lifestyles, communication and education are keys. So making sure that you're communicating your tobacco-free policy, you're educating people as to why, and you're raising awareness as to what quit resources are there, and that'll provide support for the users and support successful implementation. As I get ready to turn this back over to Emily, I'll just highlight, again, these are some of our Breathe Easy Coalition resources, and want to thank you so much for the opportunity to join you on this webinar. And also, we're going to unmute Lance, so he'll be available for questions as well.
So we're going to go through the questions. I think you guys can all see these in the panel on the side of the screen. Oh, sorry. Actually, you cannot see the questions, but I'll read them and you'll get answers. If you have additional questions, please make note and they'll pop up and we'll get an answer. So this question is for you, Lance. This is from Emma Valancourt. Speaking as a Thornton Academy alum, did the school find out if these companies were selling to youth, and do you know if they revised their policy for all tobacco products, including electronic cigarettes, on school grounds?
I'm trying to recall exactly. At first, Thornton Academy was not necessarily unreceptive, but not really overly receptive to our inquiries. The individual who took the photos went to the Press Herald, and the Press Herald did a story. So that's what, I mean, it was more through working with the company. It turned out her daughter was driving the car to school, that they agreed not to have her do it anymore. And I don't believe at that time Thornton Academy's policy did not include e-cigarettes, and they did not initiate a change at that time. I don't know if in the year or so, I guess it's actually probably almost 15 months, that they have or not. I was just actually on Thornton Academy's website trying to find out if they have included e-cigarettes, and they don't post their tobacco policy online.
Well, I bet through our Healthy Maine Partnership Network, we could probably find out that answer too.
Right.
I think there may have been somebody from the HMP on earlier. So if you're around, you can feel free to put your response in the comments. The person from the HMP down there. So we've got a couple other questions here, and I think, Lance, these would fall to you as well. These are all about the OTP tobacco taxes.
Sure.
How does Maine compare to OTP tax to states outside of New England, and specifically with states in the Southeast? And I did find a tobacco-free kids link that we'll send out to everybody as a follow-up as well, that you can see that.
Yeah, I was actually, I haven't looked much outside of New England. I have the rates just because of lungs territory that the American Lung Association Northeast covers. But while Sarah was going on presenting, I did check out, and several of the Southeast states have a lower rate. I mean, they're more in the 10 to 15%, so pretty similar to with the exception of Florida, is at 85% of wholesale. So for the most part, Southeast is a little lower than Maine, but not too far off.
And that's, I think, an important distinction, that that's OTP and not just tobacco cigarette taxes, correct?
Correct. That's only for, that's the other tobacco products. I did not look at their cigarette excise tax.
What are your thoughts about the likelihood that that tax, the OTP tax, will be increased in Maine?
It won't. I mean, I can never guess in the legislative process here, but it's a pretty safe bet that it won't happen this session, since they passed the budget last night and OTP was not included in that. But over the past 2 to 3 years, there's been more dialogue within the legislative committees, in at least interest in looking at it. So not this year, but perhaps in future years you might see that seen as a both a good public policy and a potential source of revenue.
And the OTP tax has to be done at a state level, correct? Can it be done at the municipal level?
No, I mean, Maine communities can't collect sales tax or pass local sales tax, so it would have to be done at the state level.
And then another question for you, Lance, before we move on to the other questions is, what about the likelihood that the president will sign the legislation to put e-cigarettes under the FDA jurisdiction?
On national policy calls with our American Lung Association national staff, it seems like that the White House is now saying that the sign-off on the regulation will happen in July. That date has moved several times, so at least indications seem like it's coming and imminent, but we'll see. We're predicting Friday, July 3rd in the late afternoon.
And then I think this question is more directed to Sarah. How do we find out more about applying for the Gold Star Standards of Excellence program?
Oh, great. Thank you for that question, Will. We run 2 programs of the Gold Star Standards of Excellence, one for colleges and one for hospitals. You can check our website, breatheeasymaine.org, and we'll release our hospital awards program. We'll get sent out to all of the Maine hospitals, as well as go on our website in probably August. For that program, applications will be due in October and a celebration in November. And then in the winter, we'll hold our college program, again, probably a release in December or January for those awards programs with a celebration in March.
And if folks wanted more information about that, you could reach out to you directly.
Exactly. They could contact me. We'd be happy to chat with them about it.
And provide the technical assistance to get folks there.
Totally.
Great program. So those are our questions. Do we have any other questions? I didn't see any under the chat section or here in the questions. Well, thank you very much for participating in this third webinar of our series. We really appreciate your participation and having some great discussion and questions. Please look for this webinar posted on our website, and you can share that with other colleagues who might be interested who couldn't attend. And please stay in touch with the Cancer Consortium. You can sign up for our listserv, or you can send me an email at erines@mainecancerconsortium.org, and we will get you linked in. Thank you very much. Have a great day.